Operators of a health program that travels to the neighborhoods are trying to reach more young people thanks to a makeover with a new design. They hope to spread more information about health concerns such as obesity and sexually transmitted disease. To tell us about the strategy is the Executive Director of the Family Van, Jennifer Bennet. Thank you very much for being with us, Jennifer.
Thanks for having me.
There are, I am sure, hundreds of people who have visited this van over the past 20 years or so, but
Yes.
For those who haven't and who haven't even taken notice of it, what exactly is this?
So we're a mobile health clinic. We travel to Boston neighborhoods, Roxbury, Dorchester, and East Boston. And we focus on prevention. We do free screening and testing. And for a number of chronic illnesses like obesity, diabetes, hypertension, HIV/AIDS, things like that.
I know in recent years, one of the first things you try to do is figure out which people you need to reach more effectively. So what did you end up deciding?
Well, what we've noticed over time, Chris, is that there's a lot of folks who have health issues that don't recognize that they're ill. For instance, about 10% of the people that come on the van annually have an undiagnosed chronic illness. More recently, we recognized that even though there's a lot of youth in the neighborhoods that we're serving, they weren't necessarily coming on the van. So we started interviewing them, talking to them, doing focus groups, and we learned that they didn't really understand what kinds of services the van could provide for them. And they also didn't find the van very appealing. Like, it just didn't look like it was a program for them. So we went through this year-long redesign process where we worked with students from Emerson College and from MassArt. The Emerson College students did a social media campaign for us. And the MassArt students, we worked with a team of graphic arts students to come up with designs. We had 5 designs ultimately that we selected, and we brought them out to the neighborhoods and had our clients vote on them, literally, and tell us which design was more appealing, and we hope that will attract more local youth.
Well, the design you ended up choosing looks less medical than the vans I remember from before.
Yeah.
It's almost like a food truck.
Yeah, I think our goal, Chris, is really to clearly communicate what services we were providing and to reflect the vibrancy and the diversity of the communities that we serve. You know, so if we can get somebody to come and step on board, once you get inside, it's very, you know, we follow clinical protocols. The services are basic screening and testing that are provided by community health workers and HIV testers and counselors and even medical school students. So the whole goal is just to get them involved.
Now, one of the concerns with younger people is HIV infection and AIDS. Now, a lot of kids in high school might be thinking, how am I going to get that? I don't have to worry about that. So
Right.
What's the big issue here?
Well, it's interesting that you mentioned that because there was a survey in 2011 of local youth here in Boston, high school students, and actually almost 27% of them didn't really know what HIV/AIDS was, whereas nationally that's about 16%. So these kids sort of feel invulnerable and they don't recognize that this is something that they're at risk for. And unfortunately, in the folks that we're working with, they're at an even higher risk for HIV/AIDS. So our goal is to get them to come on for some service. It could be anything really, and then we tell them about the number of 9 different types of screening and testing that we do, and we educate them about sexual reproductive health and a number of other things.
Well, one thing I think the city has found among young people is that there is quite an incidence of sexually transmitted infections of some kind. So that means there's probably some risky behavior going on.
That's right. Unfortunately, there's quite a bit of high-risk behavior and a lot of misunderstanding. And our program really focuses on what we call improving health literacy, helping people really understand what the facts are versus the myths. So in addition to having our mobile program, we go out and do workshops with churches, with other community groups, and we do a lot of that, sort of telling people what are the real facts versus the myths.
Chris, a lot of the people you're trying to reach, I imagine these are people who are not very old. They might not think that they're ill with anything. They might not even have a headache in the morning. Who knows? But I guess you still need to reach people who are like that because I guess they could have some concerns.
Yeah. You know, typically people, if they're feeling unwell, oftentimes they're too busy to go to the doctor. We all know it takes a little bit of time to get in to see a doctor. The whole concept of mobile care is that you're bringing care, preventative care, into environments where people are every day. where they work, where they live, where they're going to school, where they might be playing in a park across the way, and they just see this mobile van, and then they think, oh gosh, I had this health concern. Maybe I could just step on board. So we're removing those barriers of time, transportation, and maybe just people feel sometimes unwelcome in the healthcare system. So the whole idea of these mobile programs is that it just really removes barriers to care.
Now, another kind of barrier, some people, as soon as you hear the term health van, they might be thinking, oh, that must be for women.
Mm-hmm. Yeah. Well, actually, it's very interesting. Our program was originally designed with the idea of providing prenatal care because there were very high infant mortality rates in Boston when we were founded by Dr. Nancy Oriole. However, since day one, we've always had almost equal parts men and women that come onto the mobile unit every day. There's something about the power dynamic of the care, the difference between the providers and the patients is not as obvious as it would be in other clinical settings, and it makes men feel very comfortable. So, whereas in a typical healthcare setting like primary care, usually it's a 3-to-1 ratio in terms of the number of women versus men that would go to use the service. So we see a lot more men annually than a typical primary care practice would actually.
Now, look at the expense of running this van and the difference it makes in the cost of healthcare.
Yeah.
Anything you can say about that?
Yeah, absolutely. So, until very recently, as a country, our whole healthcare system wasn't really focused on prevention. It was focused on illness. And that is much more immediate. But we published a study several years ago, actually, where we've proved the value and the cost savings of these preventative interventions. And we've now done that same study. We've been able to quantify the value of dollars and cents that we've saved each year. And we average 27-to-1 in terms of dollars saved every year for the money that we spend on the unit every year.
Well, I know there's a way to get in touch if people want to find out more details, maybe, for instance, about where this van is going to be and when. So I guess there's a way they can do that?
Oh, certainly, on our website at familyvan.org or by calling us in our office at 617-442-3200.
Thank you very much for being with us. From the Family Van, Jennifer Bennet will have more news in just a moment.